During the congressional hearings, it was found that the National Cancer Institute, along with the Royal College of Physicians and Royal Statistical Society, were involved in the conspiracy and actually published as independent studies data that was erroneous and supplied by our own U.S. National Cancer Institute to the British workers. This was brought out of the hearings, and they said, we can no longer go with this. We're telling the National Cancer Institute to go back, do additional research, and 3 years from now, in 1980, we want studies on animal studies to find out whether fluoride causes cancer or not. I was supposed to be on the protocol committee. I never was. 1980, no results came out. In 1982, we found they were starting their studies. In 1984-85, they said the studies didn't come out right, so we have to redo them. But in the meantime, in Japan in 1984, a group of investigators headed by Dr. Tsutsui found they could transform normal cells into cancer cells merely by exposure of these cells to fluoride. And it occurred within a matter of days, because they used slightly higher concentrations. They used 30 parts per million instead of 1 part per million. And the National Cancer Institute was still working away on their so-called studies. In 1988, Argonne National Laboratories, which is one of the most prestigious laboratories in the country, confirmed the Japanese work, which is published in Cancer Research, and stated not only did we find that fluoride caused cancer, but also that it stimulated cancer caused by other cancer-causing substances, published in 1988. Finally, we got leaks from Battelle Memorial Institute, which was doing the study for the U.S. Public Health Service. And those leaks were, first, that fluoride appeared to be, at least in male rats, responsible for an increase in bone cancer. And then after that, in getting Battelle's data, we found that fluoride was definitely linked to a rare form of liver cancer called hepatocholangiocarcinoma. Never occurs in untreated animals, only when carcinogens are given. And as the fluoride concentration went up, this rare form of liver cancer went up. Never reported, except we have the data now from Battelle. And we also found in male and female rats an increase in oral tumors and cancers as the fluoride concentration went up. In 1990, this hit the press. And there was, equivocal link between fluoride and bone cancer, but none of the most important cancers were mentioned. And because this concerned our friends of the Public Health Service who had been promoting fluoridation since 1950, Dr. James Mason, who is notorious for making fraudulent statements in the area of fluoridation anyhow, called, and by the way, he's your top health officer right now. I remember one time a congressman asked about Dean Burke, is it true that Dean Burke is a eminent chemist at the National Cancer Institute? He said, no, he worked for the Canadian National Cancer Institute. And it took a threat by Dean Burke of a suit against Mason to make him admit that Dean Burke did work for the National Cancer Institute of the United States. And he is now your top health officer. He is Undersecretary of Health for Health and Human Services. Now, I've heard people at these lectures say, cooperate with the National Cancer Institute. Cooperate with the U.S. Public Health Service. Let me tell you, the people in charge, in my opinion, are absolutely corrupt. You cannot trust them, ladies and gentlemen. They're in bed with some evil elements, and I don't know all the ramifications. But you cannot expect a fair shake from these people. So he started this committee with, how many people heard of Frank Young, former FDA commissioner? Yes. Frank Young was put at the head of the committee, and in the committee were a bunch of the people who had promoted fluoridation for all these years to do an independent analysis, another whitewash committee. In between time, the National Cancer Institute had done studies among human male populations to see if this bone cancer that was found in male rats could be found in males. They found the incidence of bone cancer in males, published in 1991, was 50% higher in fluoridated areas. That study was given to this committee, headed by Frank Young and a bunch of the lackeys, and the result was, we can now assure the American public that fluoride doesn't cause cancer. 1991. So I got a call from Frank Young. He said, John, he said, I thought you might be interested in seeing our report. and maybe want to meet with me here for a couple of hours in Washington, D.C. And I said, great, Frank. I said, I'm going to send you some questions that I want to answer before we meet. About 40, 50 questions. Embarrassed, he couldn't answer the questions. I said, well, what's the sense in meeting? He said, well, come on down anyhow. And I did, and I have a 2-hour tape of our meeting. And believe me, they don't know what they're doing. Not only are they corrupt, they're also ignorant. And if this ignorance can be brought to light, we're in good shape. We have a government overall that's in shambles. It's not only in Health and Human Services. Since 1985, I have been advisor to the president of the Union of Professional Workers and Scientists at the United States Environmental Protection Agency. Bob Carton is one of the people I've worked with. And over the years, despite the fact that their administrators have said that fluoride is absolutely safe, last year, I think it was in Lancet, the British Medical Journal, the chief toxicologist for the Bureau of Drinking Water admitted that fluoridation causes cancer, citing my work and additional work that we did showing that fluoride doesn't even reduce tooth decay when added to the water supply. This was in the Lancet. And he was told for making these statements that he might lose his job. Thank goodness there was a union there to protect him. I met with Bob Carton a couple of weeks ago at a convention we had in Columbus, Ohio. And he said, John, he said, we only have about 1.5 years before they throw all of us out. Now we have PhDs who are trained, who are being told by people who have degrees in Chinese literature what to tell the public about fluoride. You've got to ask yourself where these people are getting their marching orders. And the union has taken fluoride as its #1 issue because it is so clearly evident that there's fraud there. How many people saw that program on 60 Minutes on the mercury amalgam fillings? Okay. I helped put that together. And I think it was probably one of the best shows on our side that I've ever seen. I think they did an excellent job. We have and are working now with members of the American Dental Association. ADA has supported fluoridation for years, who are suing the American Dental Association for fraud and breach of contract with regard to statements they've made with regard to fluoride, fluoridation, and mercury. We are not dealing with science anymore. We're dealing with politics. As you probably know here, many of the therapies that have been used have proven successful. So we're not really trying to prove our case with regard to whether these methods work or not. What we're doing is we're dealing with people whose money is coming from not us, the taxpayer, but somewhere else. Or there's a revolving door between the Food and Drug Administration or the Public Health Service and the industries they're supposed to regulate. But as I said, this is not only true in the Department of Health and Human Services. The Environmental Protection Agency is a separate division, and it's also occurring there. And it's also beyond the health and environmental area. Now let me tell you something, and I think many of you realize this. We don't treat symptoms. Fluoridation is nothing more, and what's happened in the fluoridation issue is nothing more than a microcosm or a small piece of what's happening overall. I can tell you some of the things that I've done in the past. How many people live in Los Angeles? How many people realize that your water is not fluoridated in Los Angeles? Do you realize why? Okay, one of the reasons is because I was brought into Los Angeles and conducted your political campaign to stop fluoridation in 1975. And I'm happy to say in many other parts of the country, I, with the help of many of you, have been able to stop fluoridation. In 1985, we stopped it in San Antonio, Texas, against unbelievable odds. Everyone there wanted to fluoridate it. But the interesting thing, surprisingly, the person who helped lead the campaign was working as a volunteer for the American Cancer Society and was disturbed to find out that they were going to go ahead and fluoridate the water there. And she threw down all her volunteer work and went out and led the campaign and called me in to help them to stop fluoridation. We outspent 15 to 1, and we won.